Hey everyone, this is my weekly 5 recording for my integrated cardio and respiratory assessment. This is my patient for today, Dad. He stops pulling faces. Okay, so let's get started. So the first thing I'll be doing is preparing for patient assessment. So I'm checking my scene, I'm making sure that everything's okay. Yeah, everything's safe, there's nothing obstructing my way to getting to my patient, everything looks good. The next thing I'll be doing is putting on my standard precaution, so for example my PPE, which would be gloves. And the next thing I'll be doing is explaining the procedure and getting consent. So, hey Dad, how's it going? I'm Talia. I'm going to be doing just a cardio and respiratory assessment just to make sure that everything's alright and you're breathing okay and nothing serious is going on, okay?
Okay.
Alright, so I've gained my patient consent. I'm making sure that my patient is sitting upright. So Dad, can you just make sure you're sitting nice and upright in it, making sure that he's in a position of comfort. Okay, so the next thing I'll be doing is general appearance. So what I'll be doing is assessing Dad's breathing, the rate, the rhythm, and also the quality. So I'm just going to assess your breathing today, okay?
Okay.
And I'll be doing this for about a minute. Okay, so I got a breathing rate of about 18. I think because I was counting it as well, Dad was a little bit nervous. So the rate was normal. The quality is very well. It doesn't sound like he's struggling to breathe. And the rhythm's really good. It's not like it's erratic or anything like that, so that's good. Patient position, so he's in a pretty good relaxing sort of position. It's not like he's trying to stretch out his lungs in that tripod position where he's struggling to breathe, so that's really good as well. Hi, how's it going? Have you had a good day today? Yeah, okay, so that's all I'm gonna get. His ability to speak is good. He's able to speak full sentences. When I was checking for the scene, I was also looking to make sure that there was no home like oxygen tanks or any respiratory meds. So do you take any puffers or anything like that? No? Okay, no. So he doesn't take any respiratory medication, and there was no presence of a cough. Okay, so the next thing I'll be doing is inspection. So can I just check your nails for me? So I'm just checking to see if there's any splinter hemorrhages or any nicotine staining. I can't see any. Nails are so bad. Okay, if there's any clubbers or anything like that. The next thing I'll be doing is checking his skin. So his skin color is really normal. He's not pale or anything like that. He's not sweating, or he's not clammy, which is a good sign. The temperature of his skin is not overly hot or cold, and his condition's pretty good at the moment. He's, he's pretty normal as can be. Okay, so the next thing I'll be looking at is I'm checking his pulse, his rate, and the rhythm. So I'm just going to check your pulse, okay? And I'm going to do that for 15 seconds and I'll times it by 4. Okay, so I got 20, so I times that by 4, that's 80 beats per minute, which is really good. And the next thing I'll be doing is checking Dad's blood pressure. So I'll be doing a manual BP. And Dad, okay. Just going to take your blood pressure, is that okay?
That's okay.
All right. Okay, so now I'm going to be taking Dad's blood pressure. Alrighty. So I got a blood pressure of 110/70, which is really good. Okay, so I got a blood pressure of 110/70, which is really good. So the next thing I'll be doing is just checking. Can I just have a look at your eyes, buddy? Yeah. Just checking his skin all over just to make sure that he doesn't have anything, abnormalities or anything like that, and he doesn't. It's pretty normal, which is a good sign. So the next thing I'll be doing is exposing my patient's chest. So can I please get you to take your shirt off? Okay, so I'm exposing the chest and I've got to calculate. I'm going to check his respiratory rate. Okay, so can you just take some nice deep breaths, just normal breathing. I'm just going to check your respiratory rate. Okay, so I got about 18 breaths per minute, which is a normal range for respiratory rate. So now I'm also checking my patient's chest to make sure that he doesn't have any visual scars or anything like that. He doesn't have any scars that would make me think that he'd have a pacemaker or anything like that. Or any wounds or anything like that, which is also a good sign. The next thing I'll be doing is, so I'm just going to place my hand there. And what I'm feeling for is I'm inspecting the abdominal area to make sure there's no mass there, and there's no mass, which is so good. The next thing to do is palpation. So what I'm going to do is I'm going to place my palm on your chest. Can you breathe in for me? And breathe out. Breathe in. Breathe out. Any pain?
No.
Breathe in. Breathe out. Any pain?
No.
Okay, can you turn around for me? Alright, so I'm going to place my fingers in the back of his... Okay, can you breathe in? And out. Breathe in. And out. Okay, so I can't say that his breathing's normal and symmetrical. Like there's no, like one side's rising and the other side's not, which is good, which is normal. Okay, so the next step I'll be doing is percussion. So can you just turn around for me? Thank you. So what I'll be doing is going in the spaces of his ribs and just giving a little tap. Okay, nothing. It sounds quite like when I tap on it, it's very normal. It's no abnormal, like it doesn't sound like there's fluid or anything like that in it. Sounds really good. He's breathing. I can't hear any of his breathing being crackly or anything like that either. Okay, so the next thing I'll be doing is auscultation. So what I'm going to do is examine Dad's, and I'll be doing this 6 times the lung fields. All right, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in. Very good. Breathe in. Breathe out. Okay, good. So when examining his breathing, I can't hear any crackling or any wheezing, which is a really good sign as well. Okay, so now I'm going to just listen to Dad's heart rate to make sure it's a normal heart rate. Okay, so breathe in, breathe out. Okay, so Dad's heart rate is pretty normal. He has a normal sinus rhythm. He's not tachycardia or bradycardia, so that's a really good sign. So the next thing I'll also be doing is additional examinations. So I'll be checking to make sure Dad doesn't have any edema. So can I have your foot there? Alrighty, that's so bad. Okay, so basically Dad doesn't have, his feet aren't swollen or anything like that. So he has no edema. Grab your other leg. Yep. So there's no swelling. If there was any swelling or anything like that on both sides, it has something to do with the heart, and if it wouldn't bounce back when you press your fingers into it. I'm just going to check here. There's also a pulse here. It's a dorsal pulse. Yep. So that's good. So he doesn't have any edema, which is good. If he was bed bound, I could check to make sure that he doesn't have any sacral edema as well, which he doesn't, so that's really good. Okay, the next thing I'll be doing, if it's necessary, I would undertake other testing, for example like an ECG if it's needed, just to get a better understanding or anything like that with the heart rate, just to make sure that everything's okay. And I'd explain my findings to my patient and give him his shirt back. So, Dad, there's nothing going on at the moment. You're doing really well. Your heart rate's normal, your breathing's normal. There's nothing serious going on. Okay, you can put your shirt back on. Thank you.
Thank you.